how does a single glass slide turn into a digital file larger than 2 hours of HD video? And why does it matter for patients? The answer is digital pathology.
When you think of a pathologist, what comes to mind? Probably someone leaning over a microscope, right? Staring at a little glass slide. And for more than 100 years, you'd have been spot on. But right now, pathology, one of the absolute cornerstones of medicine, is going through a massive digital revolution. Okay, let's get into it. For forever, pathology has been all about physical things. You've got glass slides, you've got couriers shipping them across the country, and only one person can look at it at a time. Well, that's all changing. We are moving into a digital world where those same slides can be shared instantly, anywhere on the planet. It's a huge shift from a physical object to a powerful stream of data. So what exactly is digital pathology? While the textbook definition says it's an image-based environment for handling pathology info from a digitized slide, which is true, but, we can do better than that. Let's try a couple of analogies. It's basically the same leap we saw going from old-school film cameras to the digital cameras we all have now. Or, here's my favorite one. Think of it as Google Maps, but for human tissue. You can zoom way in, pan around, measure things, drop a pin, and instantly share that detailed map of a patient's cells with an expert on the other side of the world. Okay, that sounds pretty amazing, but how does it actually work? How do we get from a tiny piece of tissue to a full-blown diagnosis on a computer screen? Let's walk through that workflow. So, the journey starts the old-fashioned way, a tissue sample on a glass slide. But here's the twist. Instead of going under a microscope, it gets put into a high-speed scanner that creates this enormous digital file. We call it a whole slide image. From there, it's securely managed, pulled up on a monitor for a pathologist to analyze, and then archived forever, a permanent digital record. And the key to making this whole thing possible is just an incredible leap in speed. In the early days, scanning a single slide could take up to 24 hours. Today, modern scanners can capture that same insane level of detail in as little as 30 seconds. That's the leap that makes a fully digital lab possible. And you gotta understand, these are not just simple pictures. The amount of data we're talking about is immense. A single digital slide can easily be over a gigabyte. That's as much information as 2 hours of HD video. All that rich detail is what gives it so much power. So we have these incredibly detailed, data-rich images that we can create in just seconds. But so what? Why is this such a big deal? Well, it's because it's kicking off a total revolution in how we diagnose disease. At the end of the day, it's all about better patient care. A diagnosis that used to get held up for days waiting for a slide to be shipped can now happen almost instantly. A top specialist in New York can consult on a tricky case from a small rural hospital in real time. This isn't just about convenience. That speed and collaboration directly leads to more accurate diagnoses. But it's about so much more than just doing the same old thing on a computer screen. Experts like Dr. David Klimstra see a future where we use all this data to find new digital biomarkers. These are subtle patterns in the image itself that could tell us how a tumor is going to behave or which drugs will work best against it.
By the way, if you're curious about how all this fits together and want a clear, structured information, I wrote a book, Digital Pathology One-on-One, and there's a free PDF version for you to download. It's packed with the basic and not so basic information necessary to understand the space of digital pathology, and you can grab the digital copy through the link below. It's a great starting point to follow along with everything you're learning about here.
And that brings us to the most transformative part of this whole story, artificial intelligence. This is where digital pathology stops being just a better microscope and turns into a completely new kind of tool. The number one thing that AI is incredible at is pattern recognition. You can train an algorithm on millions of images, and it learns to see these incredibly subtle patterns, textures, and relationships between cells that are often totally invisible, even to the most experienced pathologists. Think of AI as the ultimate co-pilot for the pathologist. It can handle the boring stuff like counting cells, it can flag tiny areas of concern that a human eye might just scan over, and it can act as an amazing digital second opinion. But its real power? Prediction. Seeing patterns that actually correlate with how a patient is going to do. Now get this. This is where it feels like sci-fi. We are already at the point where an AI can look at a standard tissue slide and predict the probability of specific genetic mutations in a tumor. This could totally change the game, getting patients the right targeted therapy way faster without waiting weeks for separate genetic tests. It's huge.
Now, I know this all sounds absolutely amazing, but the big switchover isn't happening overnight. Let's take a second to look at the real-world challenges before we peek over the horizon at what's coming next.
Look, there are some serious hurdles. Financially, the initial cost for scanners and software is really high. Technically, storing and managing petabytes of data is a massive challenge. And then you have the human element. You've got to train pathologists in a whole new way of working and get past that cultural attachment to the good old microscope.
But you know how it is. Technology never stands still. Even as labs are adopting today's digital pathology, the next frontier is already here. It's being called glassless pathology. Imagine creating a perfect digital image directly from a piece of tissue, completely skipping the whole process of making a glass slide in the first place.
The potential here is just enormous. The current process takes hours, sometimes days, and it uses up tissue. A glassless future could give you a diagnosis in minutes, and not only is it faster, it saves that precious tissue for other critical tests, like genomic analysis. So let's wrap this up with one final thought. Digital pathology, especially with AI, is about way more than just cool tech. It's about democratizing expertise. It's about creating a future where your diagnosis isn't limited by your zip code, but is connected to the world's best specialists and the collective knowledge of medicine, all available in an instant.
Digital pathology is changing everything, but no technology is perfect. And as much as I love digital pathology, I'd like you to see the full picture. So check my other video where I go deeper into the advantages and disadvantages of digital pathology. You should be able to see it here or here, and I see you there.